RAI Therapy. What are radiation safety protocols? Radioactive iodine therapy, commonly known as RAI therapy, is a widely accepted treatment for hyperthyroidism and certain thyroid disorders. This therapy primarily uses iodine-131, which emits radiation. Because of this, it is crucial to follow specific safety protocols to protect patients, caregivers, and the general public from unnecessary radiation exposure during and after treatment. After receiving RAI therapy, patients are monitored until their radiation levels drop to a safe threshold, typically around 50 microsieverts per hour. Only when they reach this level are they discharged with detailed safety instructions to minimize radiation exposure to others. Personal hygiene plays a significant role in radiation safety. Patients are advised to flush toilets twice after use, keeping the lid down to reduce contamination. Males are encouraged to sit while urinating to avoid splashing. After brushing teeth, it is essential to rinse the sink thoroughly. Daily showers for at least the first 2 days post-treatment help wash off any radioactive contamination from the skin. Clothes that may have been contaminated with saliva, urine, or other body fluids should be washed separately. Minimizing close contact is another critical aspect of safety after RAI therapy. Patients should sleep alone for several days and avoid kissing, hugging, or any close physical contact, especially with pregnant women, infants, young children, and pets. This precaution typically lasts about 7 days, but it is best to follow specific advice from healthcare providers. Sharing utensils, towels, bed linens, and undergarments should also be avoided. Environmental precautions are necessary as well. Frequently touched items, such as telephone mouthpieces, should be cleaned with damp wipes. Contaminated materials, like disposable dishes or gloves used during cooking, should be disposed of properly, often in sealed plastic bags. Traveling after RAI therapy can present challenges. Patients may trigger radiation detectors at airports for some time after treatment. Carrying a medical certificate that explains the recent RAI therapy can be helpful. Long-term precautions are also advised. Women should avoid pregnancy for 6 to 12 months after RAI therapy to prevent any potential radiation effects on a developing fetus. Men are generally advised not to father a child for at least 2 months post-treatment. Breastfeeding is another important consideration. Women must stop breastfeeding at least 6 weeks before RAI therapy and should not resume afterward due to the risk of radiation exposure to the infant. The purpose of these protocols is to minimize radiation exposure, as iodine-131 is primarily excreted through urine, saliva, sweat, and other body fluids. These safety measures are particularly important for protecting children and pregnant women, who are more vulnerable to radiation. In summary, radiation safety protocols after RAI therapy focus on minimizing exposure through good hygiene practices, limiting close contact, and following specific guidelines regarding pregnancy and breastfeeding. Patients receive personalized instructions based on their treatment dose and individual circumstances, making adherence to these protocols crucial for safe recovery and the protection of others. Always consult healthcare providers for specific advice and concerns regarding radiation safety.